Okay, my name is Annisa, Nurse Annisa, and I will be leading today Handover. So, for my share, before I start, can you just introduce yourself?
Okay, my name is Meuthia as a nurse in the afternoon shift, and my name is Nurse Akti as a nurse in the morning shift.
Okay. So now we will discuss about two patients. There is one patient is Mr. John Carter in the bed one, also Mr. James in the bed two. So after our discussion here, we will move to the bedside and confirm that with the patient that there is a change in the nursing team or handover. So let's start with Mr. Carter first. Okay. Mr. John Carter is a 62 years old male, retired teacher and married. He was admitted 3 days ago due to an exacerbation of chronic obstructive pulmonary disease or COPD, and his main complaint upon admission were worsening shortness of breath and increasing coughing and sputum production. And since then, his condition has improved with the treatment, but he still requires oxygen support via nasal cannula at 2 liters per minute and maintaining oxygen saturation between 94% and 96%. He's stable and without fever and is able to ambulate with assistance and eat normally. And his current medication include salbutamol nebulizer every 6 hours and oral prednisone 40 milligrams once daily. And Akti, okay, Nurse Akti, can you share the latest vital sign and physical findings?
Okay, his body temperature is 37.7 degrees. Blood pressure is 105/44 millimeters of mercury, and heart rate is 81 beats per minute, and respiratory rate is 20 cycles per minute. His oxygen saturation is stable at 95% with 2 liters per minute of oxygen support. On examination, his lungs show signs of emphysema and fibrosis, consistent with his COPD diagnosis. There are no visible infiltrates or pleural effusion on his chest X-ray.
Okay, thank you for information, Nurse Akti. To confirm my understanding, is it correct that Mr. Carter still require oxygen support at 2 liters per minute? And is there any plan to reduce the prednisone dosage soon?
Yes, that's correct, Ms. Meuthia. Oxygen support is still required at 2 liters per minute, and the doctor hasn't planned to reduce the prednisone dosage at this time.
Okay, I want to confirm that we will continue to monitor his vital sign every 4 hours and provide mobility assistance if needed. Is there anything else we need to focus on in the care plan?
Okay, no, Nurse Meuthia, no further addition, thank you. So we will move to the second patient. Okay, there is a Mr. James, is a 31 years old male, previously healthy, who was admitted with symptoms of fever, chest pain, vomiting, and diarrhea. Based on diagnostic tests, he was diagnosed with a community-acquired pneumonia or CAP caused by Pseudomonas aeruginosa. And this is an unusual case, which is not commonly associated with CAP in healthy individuals. And however, Mr. James had a history of soil ingestion, and which likely contribute to his infection. And his current treatment include piperacillin tazobactam and ciprofloxacin. And Nurse Akti, can you share the latest vital sign and physical findings?
Okay, his body temperature is 38 degrees, and the blood pressure is 100/60 millimeters of mercury, and heart rate is 83 beats per minute, and respiratory rate is 18 cycles per minute. His oxygen saturation is 99% on room air. Auscultation revealed rough breath sounds bilaterally. Additionally, laboratory results indicated elevated white blood cell count, C-reactive protein, the dimer, creatinine, and bilirubin levels. And chest CT revealed suspicious lesions in the left lower lobe, with cavitation observed in the larger lesion. He is currently receiving piperacillin tazobactam and ciprofloxacin based on antimicrobial susceptibility testing. These antibiotics are effective against Pseudomonas aeruginosa.
Okay, to confirm my understanding, is it correct Mr. James still has body temperature of 38 degrees Celsius and oxygen saturation of 99% on room air? And there's any plan to adjust the antibiotic?
Yes, that's correct, Ms. Meuthia. His body temperature is still 28 degrees and oxygen saturation is stable at 99%. The doctor hasn't planned to adjust the antibiotics at this time.
Okay, I want to confirm that we will continue to monitor his vital sign every 4 hours and provide mobility assistance if needed. Is there anything else we need to focus on in the care plan?
Okay, no further addition. Thank you, Nurse Meuthia. Alright, we will go to the bedside and confirm to the patient that there is a change in the nursing team or handover. So remember, this is just a brief, so no need to go into the medical details again.
Okay, thank you.
Thank you.
Yeah. Yes.
Okay. Okay, good afternoon, Mr. and Mrs. Carter. So, how do you feel right now?
I'm little feeling bad.
Okay, better feeling better, okay?
He seems like better, nurse.
Okay, I see. So, okay, my name is Nurse Annisa, if you remember me, and I'm leading today's handover. Our nursing team is changing shift, and I would like to introduce my nurse, Meuthia. Nurse Meuthia?
Yeah, my name is Meuthia from the afternoon shift.
Okay, Meuthia from the afternoon shift who will be taking over your care, and they receive detailed information about your condition and progress from Nurse Afi who cared for you this morning. And Nurse Meuthia, please provide an update to Mr. and Mrs. Carter.
Of course, Annisa. Mr. and Mrs. Carter, we have discussed you're here because diagnosis COPD flare up, and don't worry, we are focused helping you your breath more comfortability. Your oxygen is at 2 liters per minute, and that's keeping your oxygen level good. And we'll continue to give your medication, including the breathing treatment and the prednisone. It's important to take this as a schedule, and we are so happy you with walking and moving around in here as much as you feel up to it. And we also watching for any side effect you after I give you medication prednisone, like change in your blood sugar. Okay. And how are you feeling overall, Mr. Carter?
I'm feeling a bit better, but I still get off breath easily.
Oh, you get short of breath easily. Okay, and then?
And I feel anxious.
Okay, that's good to hear you improving. The shortness of breath is expected, but we will helping you manage. And yeah, prednisone can sometimes cause that jittery and anxiety. Okay, feeling. We will monitor for that. Mrs. Carter, do you have any concerns or question about his care or what to expect?
Yes, I'm worried about what he can come home. He is been here for a few days now, and I'm anxious to have him back. And also, what will we need to do at home to care for him?
Okay, those are important questions. So Mrs. Carter, the doctor, has evaluating Mr. Carter daily, and we need to see a consistent improvement in his breathing and ensure he's stable enough to manage at home. Okay.
Thank you, nurse, for the information.
Okay.
Thank you to Nurse Meuthia. I kindly ask for your help during the afternoon shift.
Okay, alright, Mr. and Mrs. Carter. I hope you get well soon, and we will excuse ourselves now. Thank you.
Okay, thank you. Get well soon, Mr. Carter.
Thank you.
Thank you, nurse.
do you feel right now?
Yes, I am feel good today.
Okay. Okay, so my name is Nurse Annisa, if you remember me, and I'm leading today's handover, and our nursing team is changing shift, and this is Nurse Meuthia from the afternoon shift who will be taking over your care, and they receive detailed information about your condition and progress from Nurse Akfi who cared for you this morning. And Nurse Meuthia, please provide an update for Mr. and Mrs. James.
Okay, thank you, Nurse Annisa. Hello, Mr. and Mrs. James. You're here because have a community acquired pneumonia, and the doctor, we are giving you antibiotic, and we are helping with your symptoms, and we are checking your temperature, oxygen, and your kidney and liver health. And Mrs. James, do you have any question?
No. Okay, keep going.
Okay.
Nurse Meuthia.
Okay, Mr. James, the doctor will give you a. Sorry.
Salman itu yang siapa?
Yeah, sorry. Fatimah. Okay. Harusnya kamu.
Any question itu aku.
Do you have any question, Mr. James? Okay, salah.
Yes, I'm James. Mr. and Mrs. James.
Sorry guys. Okay. Udah?
Kok gerak awakmu man?
Hah?
Gerak no tulisannya tak ae.
Ngapain?
Udah selesai?
Belum.
Okay. 3, 2, 1. Okay, Miss Annisa, thank you. Hi, Mr. and Mr. James. You're here because have community acquired pneumonia, and the doctor giving you antibiotic, and we are helping with your symptoms, and we are checking your temperature, oxygen, and your kidney and liver health. Mr. James, do you have any question about your condition?
Yes, I am really uncomfortable with the pain in my chest when I cough.
Okay.
Okay.
Okay, Mr. James, the doctor will give you pain medicine, and also sometimes it helping to holding your pillow, okay, and your chest when you cough, okay, and we want to be your comfortable in here.
Okay.
Okay.
I'm still worried about what the case is pneumonia. Can you catch it from him, and how long does it usually take to get better?
Okay, that's a very good question, Mrs. James. And pneumonia can be caused a different thing, and some kind of spread from person to person. And from Mr. James' type of pneumonia, we need to look at his medical chart to know if there is a risk of it spreading, and the doctor will give you the most accurate information. And also, usually people start to feel better a few days after starting antibiotics, and then the cough and tiredness can last for several weeks, and we'll keep watching Mr. James closely and keep you updated. Okay, to make sure we will understand, let's go over what we'll be doing for Mr. James. And Nurse Meuthia, can you please summarize it?
Yes, this afternoon we will.
Okay, thank you.
Thanks for your information, nurse. I could ask for you.
Alright, okay, Mr. James, I hope you get well soon.
Thank you for information provided.
Okay, there's no question again anymore? Okay, that's enough. Okay, so I hope you get a better condition later, get well soon, and thank you.
Yes, thank you.
Thank you.
Thank you.